Hello and welcome to this week's HealthTech Hour with me, Steve Roest. Each week we bring you the best news, views, and interviews with the leaders, clinicians, CEOs, and founders that are changing the face of healthcare in the UK and beyond. As many of you will know, I am a CEO and founder of a health tech venture myself called PocDoc. PocDoc's mission is to prevent cardiometabolic and renal diseases from overwhelming our healthcare systems, and we do this through our innovative technology platform that allows anybody to give themselves a test for their cardiovascular health using our Healthy Heart Check. In 10 minutes, you can do the equivalent of the NHS health check at home or in a pharmacy or in your community. If you'd like any more information or even to get a test, please go to PocDoc.co. So that's PocDoc.co. So I'm so sorry, I've misread my script. Thank you as ever to everybody who's listening live on UK Health Radio. We appreciate Johan and his entire team giving us this live platform. I would recommend that you have a listen to the other presenters on UK Health Radio. It's a fantastic station and there's lots of great presenters doing some awesome things. Thank you also if you're listening after the fact, whether you're listening on our podcast channels, we're on all of the major ones, or if you're watching this on YouTube, either the long form of the show, or if you're watching any of the sliced and diced versions of the show, the channel is HealthTech Hour. And if you're following me on Instagram, it's at Steve Roest, and in my bio, you can find the links to the shows. I would also say, as I say every single week, all of the shows from UK Health Radio are on all of the podcast channels now. So you can either find us by going to the HealthTech Hour channel, or you can go to the UK Health Radio channel, and there you'll find all of the shows from all of the presenters. So let's get on to the show. Last week's show was actually a really, really interesting deep dive into the area of open source technology and the tension between software democracy and big enterprise. Really focused on this area of how can open source be used by the NHS to enable more innovation, to solve issues like electronic patient records, to solve some of these major foundational issues. Or should the NHS continue on to invest in big enterprise off-the-shelf solutions because open source is too much of a security risk? Really interesting discussion. And Richard from Altera Digital and Joel from Interneuron were excellent guests. So I would recommend anyone that wants to listen to that, go have a listen. You can geek out on the technology. It was a really great show. On to today's show, we have actually kind of a continuation of a theme, really. So we have Rachael Fox, who's Executive VP for Altera Digital, who is an expert in clinically led electronic patient records in use across the NHS. Rachael, welcome to the show. How are you?
I'm great, thank you. How are you?
Very well, thank you. Very, very well. There's a lot to unpack here. So we'll kind of go step by step. So what we like to do, I think in the initial instance, sometimes when we've got people on the show, is it would be great if you could just give us a little bit of your journey about how you ended up where you are right now, which is Executive VP of Altera Digital, and then a little bit of info about who Altera are, and I think why it matters to the people that are listening, if that makes sense. Like why does this area matter to everybody, or why should it matter? Like why should people actually care about this?
Sure. So that's great. Thank you very much, and thanks for welcoming me to the show. I really feel honoured to be part of the show, and it's just a really great opportunity to explain more about Altera Digital Health. So my journey. So I started my career in the NHS at one of our customers. And I was there for 19 years, doing many different roles within the NHS. I did an operational role. I did project management role, program management, and then my last role was innovation and in healthcare. And then I moved to Allscripts at the time, which was acquired by Harris and created into Altera Digital Health. And so I started here at Altera as a salesperson. I was what's called like an AOE, an account manager, and I had a number of NHS customers. And I felt like for me, having that real background of NHS experience and understanding how the NHS operates made it really good for me as an expert to come into an organisation such as Altera Digital Health, because I believe I've got so much to give, so much knowledge and expertise, and it's really important that we have people within the NHS that are also helping with some of these tech companies, because it's really understand what is needed to drive improvements within the NHS. So I started as an AOE, and then I was promoted to director, then promoted again to area vice president. Then I implemented the client success program, which is really a huge benefit to all our NHS customers, because it really focuses on the NHS and it focuses on doing the right thing for the customers. And so implementing that in the UK, and that was such a success, we then implemented it into international. So I then was vice president of client success across the whole of international, so Singapore, Australia, UK, Canada, and did that for quite a while. Once I did that, that was successful and set that up. I was then promoted to executive vice president, and here I am today, and I'm 12 months into the role now.
Okay, and congratulations, very well deserved. The what would be really helpful, I think, is that what is it that Altera Digital does, and why in the background when you said it bought Allscripts, like why did it actually buy that company?
Okay, so Altera is the provider of an electronic patient record. So for people who are not sure what one of those is, it's a solution that in the old days you used to have a paper set of case notes. Those case notes would be then really difficult to find. Paper would get lost. You know, there's lots of inefficiencies within the NHS due to paper. And so an electronic patient record is to enable, patients to be cared for in different multiple locations within a hospital, but the information is shared across the hospital, so it's accessed from any area within the hospital, and it's to improve patient care and able to find the information at the right time in the right place. And so why did Allscripts get bought by Harris? So Harris is a company that acquires businesses, and they've got 10,000 100,000 customers. They've got 12,000 employees. They do around 200,000 acquisitions, and we've got like 200 offices across the world. So yeah, so it's a massive company, and they are owned by Constellation. So again, another acquisition company. And so why Allscripts was up for sale, and Altera was made from Allscripts. And
okay,
for me, Harris is a really good company to be able to it's our forever home. That's what Altera Digital Health is. Is now part of Harris's forever home.
Oh, that's nice. That's a nice phrase. So, what was it like? What prompted your decision to leave the NHS and go into the private world?
Well, I felt like it was important that we had NHS people in the private world. In my old role when I was in the NHS, I implemented Allscripts EPR, which is now the EPR solution that we have in many hospitals in the UK and across the world. And so I felt like I could give something back, not just to the hospital I worked for, but also other hospitals. And really, it's about making sure patients are cared for appropriately, properly. And because that's really the importance here, is making sure healthcare is safe and patients are treated correctly with the right level of care. So I felt that I was giving something back to the NHS.
Okay, and when you were at the NHS, and there was this transition from paper into electronic patient records.
Yeah.
At the beginning, that must have been pretty dicey and quite hard. What was that like?
Really, really hard. And one of the things I didn't realise was when I was doing the project and I was implementing the EPR, it was unbelievably shocking that the amount of people that didn't know how to use a computer. And I found that was the hardest thing, to really train then the thousands of people that would be touching this NHS EPR, and therefore we had to actually just give everybody a basic training on how
Yeah.
to actually use a computer, which it was just a big shock for me. And then obviously making sure that all the processes are all documented, really understanding how the NHS works in every single ward, in every single department,
Mm.
making sure all the documents that were on paper are now available within electronically. It was a huge task to do, but actually it was the best experience I've ever had.
Yeah, I mean, were there people at the time that were actually saying, "No, we shouldn't do this,"
Yeah.
or was everyone kind of up? Were there people that like, "No, we should stick with paper"?
Yeah, and people love paper. Paper will never go away, but people always want to revert back to paper, and so everybody loves their own document that they've created. And there was no standardization. There was just everybody bits of paper everywhere, and stuff was getting lost. It was just real difficult to try and really understand a true health of a patient because there was missing documentation all over. So, but people did love paper and still do.
So, yeah, I think that's really interesting. So, w- because there's going to be a lot of people listening. Well, I think now in the world that we live in, there's just a bit of an expectation that things will be digital. Sort
Yeah.
of, it's like the baseline expectation. So, could you paint a picture of what it was like when the record was paper in a hospital? Like all of those different stories you just threw out. Like what does that mean? So there was like a literal physical file
Yes,
that got
correct.
moved around from different places, or what
Correct.
happened?
And you had people running around with trolleys, not like you would go to the supermarket. Supermarket trolleys piled and piled high with case notes. You'd have a storage areas all over the trust, with lots and lots of paper records everywhere. You
Okay,
couldn't find anything. But we
right,
had results scattered all over. Nobody, because you had to stick them in the results. It was just a nightmare. And so when we tried to digitize the paper, we had to dismantle each of the case notes and scan them in. We ended up
right.
in a whole massive scanning bureau. It was a huge mammoth task to move from electronic or move from paper to electronic. And so it's not about scanning paper records, it's about creating the record in
Digital. Yeah,
electronic in
yeah,
the
yeah, yeah.
but
Because you had to scan them in the first place to get to Basecamp,
correct. And
and
then
then you can build
you
each.
can build on it. Yeah, yeah. So it was
But
a big
like, but was there just a lot more? Because I mean, I look at the clinical risk assessment and the clinical risk that we have now and how people view it, and it surely with that paper-based thing, there was just a lot of risk floating around the system.
yeah, yeah. And
And were people okay with that? Or is it known, or it was just sort of one of the it's just the way the system worked, so that's it?
Yeah, that's all we ever knew. That's all we ever knew in the NHS was it was always paper. Paper was how everything operated. And when there was a set of case notes missing, yeah, how we treated patients. I mean, we wrote temporary case notes, and we did rely on the patient telling us their history. It
Right.
was a huge amount of risk. Yeah. Where now
Wow.
having electronic patient record, you have the information right at your fingertips. At any department, anywhere, at any time. You can have it on site, off site. There is so much versatility
Mm.
um, to being able to treat a patient a lot, more improved because of the having the access to the data at the finger.
Okay. So this one's going to take a while. This next section. So we're going to stop for a break in about 5 minutes. So we'll split this one up over the break. But there's been some, I guess, controversies. A little harsh, but it's been a long journey, hasn't it, to get to an electronic patient record?
Yeah.
And why has well, I don't know the details because it's not necessarily my area, so I apologize if I don't know all the details. It just strikes me that sort of culturally there's a feeling that we've been trying to do this for a while, and maybe we've got here, maybe we've not. So what's the sort of history of it? Because there's definitely been some missteps along the way, haven't there?
So for me, when I implemented our EPR at one of our customer sites, that was 10 years ago. So we've been implementing EPRs for at least 10 years that I
Okay.
of. And the hospital that I worked at was the most digitally mature hospital, using the EPR that we have and still have today. And that's, we're always improving it. And that they were as part of the GDE program and, the Global Exemplar program, that is. And they were, one of the digitally mature trusts in the country. And so
Okay.
EPRs has been around for a while, a long time, but the journey to get to where we are with 90% of trusts now live with or have an EPR.
Is it 90%?
Yeah, 90, yeah. So there's 10% remaining now to have an EPR, and that should be, the deadline is March 2026.
Okay. And when you say the trust, is this an EPR in a hospital setting, or is this an EPR across the entire system?
It's an EPR across an entire trust of hospitals. So
Trust of hospitals.
yeah.
Right. So it's when someone goes into a hospital, they're able to access. Does it access their GP record as well, or is it just what happens in the hospital?
No, just what happens in the hospital, but you can integrate with the GP system as well. Yeah.
And what's that kind of and that so in my experience of running PocDoc and interacting with predominantly primary care, to be
Yeah.
honest,
Hmm.
there's been a few instances where people have mentioned that the primary care system, and I guess the secondary care system, which is what the
Yeah.
well, not all hospital, it's all hospital care, secondary care, because some of it isn't, some of it's acute, right?
Correct. Correct. Yeah.
Okay. But there's been people saying that the primary care system and the secondary care system don't interact. Is that kind of is that part of what we're
Yeah.
talking about?
Exactly, and also acute as well. So there is, we're trying to. A lot of the EPR vendors are trying to integrate the whole. So the economies of scale for data sharing between the acute,
Mm.
secondary care, and primary care. Yeah. So
And
there's
why have we ended up in that situation, do you think, where they're sort of separate? Is it just like because of the way that the system operates?
there's different solutions for different, areas of the system really, and so it's about integrating them to make one patient record across the board.
And I'm guessing the fact that maybe that in primary care there's a number of very well embedded
Oh yeah,
enterprise solutions already,
yes,
that they're like, well, why would we give up what we've got to help you over here? So you end up in this kind of commercial sort of quagmire.
yeah,
Is that
yeah.
fair?
Yeah, absolutely. And there's only a small number of primary care solutions out there. To me, and it's quite
There's only
quite
a
a
two or
duopoly
three,
there.
right?
Yeah, there's a duopoly in that space. Yeah,
Yeah, there's a duopoly, right? So why would they help you guys?
exactly.
Yeah. Okay, so why? Let's go back to one of the original questions that I asked. Why should people care about this fundamentally? Like, why is this not? Why is this whole electronic patient record not just like boring IT that no one cares about? I'm being deliberately provocative. I care about it. We all
Yeah,
care about it. I'm just kind of giving you an opportunity because we're a broad church on the show, so I like
sure.
to try and make it very clear to everyone why people should care about certain things.
Well, because it improves patient care, it improves patient health. It enables you to, hospitals to have the visibility of patient records. It enables, that a more flexible approach across the whole healthcare setting. So it really is. It's about patients first, about making sure that there's benefits and outcomes using technology to improve patient care. And it's all about the patients, and Altera Digital Health, we are focused on outcomes for patients.
So how does it improve patient health by definition, by just in and of itself?
Having the visibility of the patient information at the point of care is really
Okay.
important. Making sure that there's clinical decision support within the electronic patient record to make sure that the decisions are being made, the right prescriptions are being given, the right tests are being ordered, the right scans are being available, and it's about having all that information in one place to then enable the clinicians, because it's ultimately the clinicians who are providing the care, but having all that information at the point of care to make sure that the patient is being treated in line with the best outcomes possible for that patient.
Okay. We'll pick this up after the break. So we're going to stop for 2 minutes for the first commercial break. Thank you very much to Rachael Fox from Altera Digital, who's my guest on today's show. We will be back in 2 minutes. Hello and welcome back to this week's HealthTech Hour with your host, me, Steve Roest, and my guest, Rachael Fox, who is the Executive Vice President at Altera Digital, who are leaders in the clinical electronic patient record space. So before the break, we were digging into exactly why people listening should care, what we should all care, whether we're listening or not, about the electronic patient record and how it improves care. So I'd like to just pick up on one thing that you said. You said within your or your solution, the doctor gets, or the doctor or nurse or whoever the healthcare professional using it can access clinical decision support.
Yes.
Could you elaborate a little bit on that? Because I think that's kind of interesting as a thread.
Yeah. So it enables the clinicians to make the decisions. So it gives them the advice and guidance. So say, for instance, if we are, prescribing a medication and there's another medication that doesn't interact well with that medication, it will alert to say to the clinician, the advice is not to prescribe that medication with that, and that just helps save lots of, drug prescription errors. One of our hospitals in the UK, they have been able to massively reduce their drug errors,
Okay.
using closed loop medication by 55% because of the system has alerted and been able to stop clinicians or advised clinicians not to produce or
So,
prescribe drugs.
okay, so in that instance, right, there's a patient
Yeah.
and the clinician's there, and the clinician's looking at the patient, has made their diagnosis and says, right, I want to prescribe this drug. Do they
Mhm.
have to put that in somehow through your tool
Yeah.
when they
So
do it to and then it then what queries their existing record to then say, oh, don't do that?
yeah, correct. So yeah, they'll electronically prescribe, a specific drug in the
Okay.
system. That will then alert to say, oh, this patient's already on this and a separate medication, or this medication doesn't interact well with that medication, and so it will alert the clinician. Now, the clinician can override it if there's a need for it. It's the decision is down to the clinician always, but it will give that support, and that's why it's called, clinician support, is because it gives that support to the clinician to alert any issues that the system can identify.
Okay. And are there other instances where that decision support stuff kind of kicks in, or is it just in prescription?
No, lots of different areas. It depends how you configure the system up to what is important. So every hospital has their own workflows, their own configuration, and so the hospital has that ability to create their configuration in line with their best practices, their workflows, and that's the beauty of Altera Digital Health. The Sunrise solution is it's so configurable. You
Mm.
configure it to how you want it to work. So it depends on what each individual hospital wants their decision support to be. To me, what do they want alerting? What do they want the system to provide the guidance and support with?
And just as a kind of scale, so for all of us, how many workflows, or how would you kind of try and quantify or explain the sheer scale of complexity that is involved in delivering a system like this that's massively configurable down to the nth degree in a highly complex system like a large hospital?
Yeah.
Because that must be so many different workflows, pathways, things to figure out. Like how can you kind of like give it to us in layman's terms?
Yeah, so as part of the implementation, we do we look at what the current state today. So at each trust, when we're just about to go live within a customer, we will sit down and work through those workflows with the customer to help really document all what the workflows are at the moment. And then we then look to configure those workflows, within the system. Now it depends on, the way that our system works is we can do, a phased implementation, and so you can get the benefits so much quicker to the NHS than doing a big bang large implementation, which could take years and years, 2 years, 3 years
Mm.
to actually implement. Whereas with us, we will do the implementation and a phased approach. So if for instance the hospital wants to go live with clinical documentation as their first area, we will
Mm.
sit with them and we'll walk through each of their workflows, identifying where there's, they can be streamlined, because you don't just make workflows from paper to electronic. You actually make those lean workflows. You make sure that they're delivering the benefits you want. So you don't just change paper to electronic, but you also do that workflow mapping piece of work with every single workflow to make sure that there is no workflows that are missed.
And what are the biggest risks in this electronic, like not speaking for Altera Digital, more just broadly,
Mhm.
what are the things that that keep you up at night about things? You know, more or I guess where am I trying to get to? Nothing's perfect, right? So whereas paper, obviously, nightmare. Totally
Yeah,
understand. Lots of problems.
yeah.
Different problem set here. I mean, is it more around like if you're going to run everything digitally, then they need to have really, really robust Wi-Fi connectivity
Correct.
on their side,
Yeah.
you know, and so on and so on, and backups and disaster recovery, and like what are the things here that create risk that need to get mitigated?
Yeah, so that's the big one for me. I think that's the worry for me is not having the electronic patient record at the point, so if there's a power cut, if there's a system failure, within the trust side, because all our applications are, is hosted by each customer. And so if the customer doesn't have, access, it's then how do you access the patient record? And that's the biggest
Right,
thing that keeps me up at night is making sure we have the team available to support our customers when there is an issue like that. So when there is system downtime because the data centers overheated or any other instance, we are there to support the customer, and we have also a business continuity solution that we can
mm,
provide to our customers. So therefore, if there is an instance of downtime, there's always access to the data, so then we continue to treat the patients. But yeah, that
okay.
is a big risk.
And what are the sort of biggest differentiators in this electronic patient record space? Like, because there are other companies and things like
Correct.
that, but I'm not, not looking to get into a competitive thing, but just
Yeah.
what are the or you could think about it from the perspective of a trust, if you like, or one of your customers.
Yeah.
What are the biggest things that are most important to them about how do they make these decisions around I'll go with you, I won't go with you, I'll do this, do that? Because I feel like within this space, maybe for people listening, and maybe that's unfair, but partly for me is sort of there's such an expectation that an electronic patient record just exists, you know,
Mhm.
just
Mhm.
it just should be that way from the punter's perspective. I think that glosses over a huge amount of the complexity and like the decision making criteria that go into actually how you choose the provider, how you implement it, all that kind of stuff. So, can you shed any light on how they think about this, how your
Yeah.
customers think about it?
So, we've got a set of our customers that love our alternative approach, and the alternative approach that we have at Altera Digital Health is the fact that we have a modular and configurable, scalable system, and so that means that you can go live in a specific area, start seeing the benefits sooner, and then you can start implementing it as a phased approach. And that really is the benefit of our solution versus our competitors, is because it's so flexible and it's so adaptable, and the phased implementation just makes it easier for the trust to adopt. If you can imagine, you might have 7,000, members of staff in an organization, trying to train them all up, trying to get them all using the system in one big bang, taking everything away and implementing something brand new. And it's a massive change, whereas with us we do it in such a way that makes it so much easier to digest. You don't rip things out, we don't do a rip and replace module. So the way we work is you've already invested in the solutions you've bought. Don't rip them out, sweat the asset, make the best of what you've bought, and then wrap these clinical solution round the solutions you've bought. That then you can save money, because you're
Yeah.
not ripping something out. You're also getting the benefits sooner because you're only implementing it in the areas, in a phased approach that you need to start receiving the benefits in an implementation plan. But also, it gives the users the ability to learn and work with the system rather than it being a massive big bang that which creates so much stress and anxiety, and ultimately, it can impact patient care.
Yeah, I completely agree. And also, is there so some of the others in the space are more of a rip everything out, it's all in one, or it's us or nothing across the board sort of thing?
Correct. Correct. And
Okay.
that's massively risky and really hurts an NHS organisation, because just to rip something out, and replace it with something, it can take 2 years to start to do
Yeah,
that.
well, and also the risk associated with doing that is enormous.
Oh, massive, massive.
Right.
Yeah. You can
I
imagine
can't.
how difficult that would be, not only to
Yeah,
the users, but to patient data, patients' health. Ripping something out, everything that you've already invested in, the money that's already been spent, and then
yeah.
ripping it out and replacing it with something else that no one knows how to use.
Are those deals still getting done like that in this
But
era of sort of cost
yeah,
savings, and is
uh,
they're still going through?
yeah, massively.
Wow.
And the amount of money some of these are is eye watering. They're huge amounts of money. Yeah,
Yeah.
spent.
So I think this is where we got to last week with Joel and with Richard, and they were I don't know if you've come across Ants Digital or Interneuron, but their Interneuron's got this kind of cool. It's not an electronic patient record necessarily. It's called an MCR,
Hmm.
an open sourced MCR.
Uh-huh.
Um, so anyway, they were big proponents of open source, and they're sort of one of the things that they talked about was this big enterprise, all in one, off the shelf investment, which could be hundreds of millions of pounds.
Hundreds of millions. Yeah.
Yeah, yeah, easily. And but basically what you're doing is paying a huge business that needs your data in order to operate, and then you're sort of outsourcing it as opposed to trying to um, sweat the asset, if you like, of your data, which is like an EPR company needs access to your patient records to have a business.
Hmm.
So why not use that in a more clever, democratic, you know, adaptable, flexible way, right? I think that's kind of where you're coming at it from, isn't it?
Yeah, and the thing is though, the solution is up to the trust. So they implement it how they want. The data is their data. We provide the solution as an aid, to help them with their patient care. It's their data. They do what they wish with their data. It's their solution. But we help them configure it to get the best out of it, to get the best outcomes for the patient.
Mm.
So really, um, the ability of our system versus our competitors is that flexibility, and um, be able to configure it in line with what the hospital wants, not being mandated to follow a specific workflow, because
Yeah,
in the
I
US.
don't know about, I don't know more, I don't know enough about this space, obviously, but I just can't imagine what I know about healthcare professionals that they enjoy working with those big enterprise systems.
No,
But
not.
I don't know, maybe someone must like them because if you're saying deals are still getting done, then they must be there must be somebody that still wants to do that. I don't know.
At the moment, there's a number of the competitors out in the market, and I'm not saying we don't need competitors, because we all need competitors.
Sure.
It benefits the NHS, but for us, with an Altera Digital Health, we just do a different approach than our competitors, which I
Hmm.
think that's really where we should be focusing on patient outcomes. Making sure that we're delivering against the frontline digitisation program, and just really saving the NHS money by being affordable. The NHS money,
Yeah.
NHS moment is so cash strapped. It is so, there's so many financial challenges, and to allowing them to spend all this huge amounts, eye-watering amounts of money on these other EPRs that make you rip and replace everything, and mandate you take their workflows. Whereas with us, we support the NHS. We provide them with the tools and give them the system to help them, implement in line with their workflows,
So
patient care.
yeah, I mean, look, it makes a lot of sense to me. Obviously, I'm not in the product details, but what is it that they are? What makes them go with a rip and replace versus your solution? Because on the face of it, your solution sounds a lot more practical, affordable, sensible, flexible, adaptable. So, what is it that draws them to those bigger deals?
I think it's just, I don't know, because I've never actually had to buy one of those big products. So
Right.
I've actually been in the space whereby, I've experienced the reasons why. But people buy things because they buy a dream, they buy a vision.
Right.
Whether that actually comes to fruition, I don't know. I've not actually been in a space where those EPR providers, or have spoken to anybody who works with that solution
Right.
or those solutions. But for me, I think it's they're buying a dream, a vision.
Mm. And what you mentioned the misprescribing rate went down by like 55%.
Right.
What other case studies or stats do you have around the patient outcome, the health outcomes?
Yeah, absolutely.
Go
Look,
for it. Hit us with a few. I'd love to hear.
yeah, so some of our hospitals are even like when we talked about paper, 99 to 100% paper free. That's a huge.
Wow.
You go from being a fully paper based system, risk of losing paper, risk of losing it, vital information that supports patient care. Lots of some of our trusts have achieved 25% nursing time saved just by
Wow.
having to look for paper, look, everything's all in the same place. We've even been able to reduce 19% reduced length of stay in hospitals, getting patients out of the hospital to stop bed
Wait,
flow.
hold on. So the EPR helps people get out because it makes it easier to discharge them.
Correct, correct.
How's that?
Well, it's because you can prescribe, medication and prescriptions from the system. You're not waiting for somebody to run to the pharmacy to go and get.
Okay.
You can do planned discharges. You can discharge patients, in the for the future, so you can start doing the discharge process earlier. You can
Right.
look at where all you. I mean, we've got a solution called patient flow, and that's patient flow solution can then look at where patients are in a hospital setting and help move that blocker within, move patients out of ED into beds and get people out of beds into the community. So that whole process enables a quicker reduction in length of stay and get people out of the hospital quicker.
That makes a huge amount of sense. Like, it's really interesting and I think this is what I was trying to get at earlier in the show, where this matters because although people think it, I think some people have the perception that it's like, oh yeah, it's like, sure, there's a patient record and it's on the computer, and sure,
Mm,
it actually has these real practical clinical values that really tie in with the NHS's priorities at the moment: reduce the backlog, improve efficiency, net zero, patient safety, reduce risk of misprescribing. So it's almost like it's a much more active tool than just this like repository of people's information.
it is absolutely, even down to, improving patient care, by having all the information. But also, one of our trusts has said that for every pound they've invested, they've been able to save £10. I mean, which is
Wow,
a lot of money to save an organisation. So it's
that's
not.
massive.
Yeah, massive. It's massive, and those are the benefits. So, not just the clinical benefits, but also the benefits to the hospital financially.
Mm.
One of our hospitals is in the top five of ED performance, A&E performance, because of using our solution in their accident and emergency department. So, there's so
Mm.
many benefits.
And how much of those stats do you think is attributable to just a shift away from paper versus the actual Altera product being really awesome?
Yeah, and I think it's part and parcels. There's obviously part of it is relating to moving from paper, but also having the configurability of our system means that the solution can be used in line with how the customer wants it to work, and therefore fits with the trust workflows. And so I think Altera Digital Health EPR really does play a massive part in that, because like I said, ED performance is, it's all measured, it's all reported, and one of our customers is in the top five. And so it's really important that not only does our solution provide the guidance and the support and the, accessibility to patient information, but also supports the workflows to improve patient care.
Cool. Well, look, on that note, we're going to go for our last commercial break. So we will be back in 2 minutes with my guest, Rachael Fox, Executive Vice President for Altera Digital. We'll be right back. Hello, and welcome back to the last section of this week's show, this week's HealthTech Hour, with me, Steve Roest, CEO and co-founder of PocDoc, and my guest, Rachael Fox, who is the Executive Vice President of Altera Digital. So, I think I want to kind of switch it up now, because you mentioned in the intro that you've worked in a lot of other different countries across the world.
Mhm.
So how does their approach to this electronic patient record differ based on those systems? What are the kind of differences and things that you've seen?
and to be honest, well, because it's only in the international space that I've actually worked. So, in Singapore and Australia, they're quite, the processes are very similar to ours in the UK. So really, I don't see there's a huge amount of differences. The EPR, our EPR is like I said, so configurable. It really fits in line with whichever region you're implementing the solution in. Because the workflows are really down to how the individual hospital operates. And so, we're not mandating people follow a certain workflow. We don't come in and say, you're going to have to rip all your workflows out and implement ours. We really do focus on how the hospital operates, and then our solution fits in with that hospital.
Okay, and how? Was going to say, but people moan about the NHS all the time and say how rubbish it is. But how, like, how does it compare, or in your experience, having to deal with other systems? And it sounds like you've dealt with a lot of other different systems.
Yeah, and to be honest, I disagree that the NHS. I mean, I love the NHS. I'm literally, if you cut me in half, I do have NHS written through me like a stick of rock.
Like a stick of rock, yeah.
Yeah, and I am in NHS through and through. And one thing that I do want to mention is 40% of our Altera Digital Health employees are ex-NHS.
Oh, that's cool.
Yeah, because we all really understand the pressures within the NHS. We understand all what the NHS needs. And so being able to communicate with the NHS staff and really understand the challenges. There are challenges in the NHS, but there's challenges in every business, And so it's really important that we as healthcare providers provide software and solutions that meet the needs for healthcare providers such as the NHS or Singapore or Australia. Because if you're mandating hospitals to follow your processes, then it's not really beneficial to the hospital that you're providing it to.
Okay, that makes sense. Yeah, so I've spoken to a couple of people on the show that actually have said that, like, I mean, look, we work with the NHS, we love the NHS. I also love the NHS. That there's a few people that have said that actually, when you go abroad and you look at some of these other systems, that's when you realize that actually the NHS is kind of amazing in some ways. Not perfect by any stretch of the imagination, but it's a little bit like, well, be careful what you wish for.
Exactly. So we can, in the US, it's all private, and whereas we should appreciate what we've got. I mean, the NHS is amazing. 75 years of the NHS is just amazing, and so we should really be thankful for what we've got. The doctors and nurses work extremely hard to provide that level of care to all all our loved ones, and it's really important that as healthcare suppliers we provide software that meets the needs for the clinicians and the patients. And without what we need to do is make sure we don't hinder healthcare.
Yeah.
We need to be there to support and make healthcare better. And therefore, I think that Altera Digital Health has the right solutions to be able to provide better healthcare, to help provide better healthcare to our patients.
So what's the kind of next step or the vision around what's next in EPR, the world of it? Like, for example, are you going to be able to start using AI to analyze the data to yield better clinical decisions, or tap into the population health management sector, or like what's the evolution of it? Because at some point it does become a commodity, right? Like it's everywhere, and you can argue about my record's better than your record and things like that. But where's this going?
And I think so. AI is a big topic at the moment, and as you can imagine, I think every EPR provider is also, working on their AI plan. But there's lots of people now getting a little bit nervous about AI. How can AI be used positively? But the decision still needs to be with the clinician, and so that's really where I think people's views are slightly. On the fence really as to, is AI going to be the thing that's going to fix it all, or is this going to be another enabler, or is it is it, I look at LinkedIn quite regularly and see all different people's opinions on AI.
Mm.
And I do think AI has a place, absolutely. But I still think that the decision still falls with the human, the person that is treating the patient. Technology is there to be an enabler, and therefore, but clinicians are there to, they've been to medical school, they have all the,
Mhm.
all the certificates, they have all the knowledge and experience. So I think AI is definitely something that everyone should be focusing on how it can benefit, but I don't think it's the total end goal.
No, I think, with the clinical, the actual final clinical decision will be like the last piece of the puzzle,
Hmm.
if ever,
If
you
ever.
know? Yeah, if ever. I was just wondering more like, because a lot of the use cases and case studies and benefits that you spoke about were quite almost like workflow
Yes.
related,
Yes.
efficiency
Yeah.
related. Like, I just wonder whether there's a role for it in any of that to
Yeah.
kind of supercharge that, but I
I
don't know.
predictability is a good place to, we should be able to use AI, so looking at the data to identify if there's trends within populations, and really focus on how to prevent, illnesses, rather than be reactive, and be, like the whole smoking, and
Yeah,
trying to stop populations from becoming ill. Is a way that we should be focusing all our energies, is the preventative medicine,
mm,
rather than just being reactive on treating patients when they become ill. And I think that's
yeah.
the biggest focus, having real an understanding of, making sure we're putting all the measures in place to prevent illness in the first place, I think, is really what we should be aiming for.
And how does that overlap with the EPR and what you guys do? Like, how does, because by the time they're in a hospital,
Yeah.
one could argue that their sub patient is somewhat further down the pathway.
Yeah, and it's about having understanding the data. So it's that data analysis as part of maybe AI, or more of a population, and the healthcare population view, really
Mm,
be. So where is the starting point of an illness, and then really looking at it from a large scale population assessment.
okay. Um, and with so in the other countries that you've worked in, so I was thinking that one of the next big frontiers for the NHS, don't know if it applies elsewhere, but that's kind of my question, is to actually crack the primary care, secondary care
Mm.
systems talking to each other.
Yes.
Because I think that if you do that, that really feeds into what you just talked about, which is the prevention agenda. And the prevention agenda is obviously where PocDoc, where we spend a lot of our time in cardio, metabolic, and renal health. I care a lot about it personally. And so I think if you can actually do that bit of it, because a lot of, for example, the cardiology clinics, the lipid clinics, the diabetes clinics, they all sit within secondary care a lot
Yes.
of the time. And there's a lot of inefficiency between those two systems around, has the person had the right blood test, have they had their risk assessment done, have they had this in order prior to being able to be treated, and things like that. So that's what we've been finding. So I wonder whether that's the next big like frontier to crack. It would be really hard because of the duopoly, I think, in primary care.
Yeah, I
And
agree.
there's no, it would have to be like what, like a mandate from the government or some
Oh,
kind of legislative
yeah. To
structure,
Yeah, to share the data across the whole economy. Yeah. Yeah.
because I can't see them doing it voluntarily. But presumably you wouldn't have an issue. Do you guys have an issue sharing with them?
No,
Or
not at all. No,
the other
not.
way around?
So we share so as soon as the patient leaves hospital, the discharge summary will be sent to the GP, to the
Oh,
primary.
right, so you already do that anyway.
We already share the data, but I think it's generally, it's about sharing all the data, not just specific parts of it, and I think that's where the biggest emphasis needs to be right now, is to focus on sharing the data across the whole setting.
Yeah, it doesn't really make, I mean, I can understand why from their businesses they sort of feel like maybe there's some commercial threat there or something, right? But then they only feel that way maybe because they view it as almost like their data, and it kind of isn't
No, no,
their data.
no.
They've done an amazing job of building systems that help primary care operate really efficiently, really high level, and credit to them for that, like massively. But the actual record in and of itself is not in their purview.
No, and I think sharing of the data just will enable patient care to be improved. I think that is the big,
Yeah, definitely.
absolutely.
Like,
You know,
imagine if you're running like a lipid clinic, which is where we kind of came across it. Like one of the instances where we've been working is where there's a lipid clinic. The cardiologist or the lipidemiologist, whoever's running the clinic, can't see those people unless they've had an up to date lipid panel done.
yeah,
And there are people showing up, partly sometimes they don't know, that
yeah,
then they can't find out because the patient doesn't have it, they don't know, they can't get hold of the GP, or the
yeah,
patient genuinely hasn't had one done because it just didn't flow through into the primary care system around to book in the phlebotomy and to do the testing to make sure it was done in time for the lipid clinic.
yeah,
So the person's shown up, travel time, time off work, so on.
yeah.
And the epidemiologist or cardiologist has just had a 15-minute, 20-minute appointment just wasted.
Yeah, and that happens across the whole setting, and
Yeah,
there's
well, in all areas, I
there is.
assume.
Yeah, there's so much, savings that can be made from, process savings and money and time. There's so many savings across the board that can come from just having that joined up, data across the whole healthcare setting is definitely, a benefit that needs to be addressed.
Great. And just before we go, what advice would you give to anyone who's currently working in the NHS, who's thinking about going out into the sort of private market? Because it sounds like it's worked out for you, and it sounds like it's worked out for sort of 30 to 40% of Altera staff. So,
Yeah.
like, what would your advice be?
As in a customer, or are you talking as
No,
in?
like someone like you that after a while working in the system is
Sure.
thinking, and I'm like, what would you say to someone?
I'm on the, I've got two sides really, because for somebody who works in the NHS wanting to come out of the NHS, absolutely, find EPR vendors who you can make a difference, you can influence, you can provide guidance and acknowledgement. But one of the things I'm really, I don't want is people leaving the NHS. The
No,
NHS needs, the staff they've got.
that's right.
They really need the experts that are in the field. So I'm not out for taking staff away
It's a
from the
delicate
NHS.
balance.
Yeah, we there has to be a balance to make sure that we're not taking, EPR vendors are not taking people out of the NHS. If
Mm,
someone wants to leave, it's a different matter. But
sure.
I wouldn't want. The NHS is struggling with staff, vacancies and keeping their,
But
staff. I wouldn't want people to be, poached out of the NHS.
no,
To
that
help.
that makes total sense. It was more of an encouragement or like advice, but totally understand. On that note, Rachel, we come to the end of the show.
Great.
But it was brilliant to have you on. Thank you so much for coming. Thanks for your energy and for giving us, me and the listeners, a real deep dive into this and a lively dive into this space. So thank you very much for coming on.
No problem. Thanks for inviting me. I've really enjoyed it. Thank you.
Good. And thanks to everyone for listening. We'll be back again next week. Thank you to the UK Health Radio team for running the production on this show. We'll be right back next week. Thank you.